Okay, so I want to welcome everybody to session 2, poster 2 here with Dr. Todd Brown. He's going to be presenting on his work about Project ECHO. I'm going to go off screen and I'm going to hand this over to Dr. Brown. Thank you so much for being with us today.
Thank you. Thank you for that. So today I wanted to present on Project ECHO, as was mentioned, and specifically we are looking at the quality and effectiveness of ECHO dermatology at the University of Utah. So first to give a little bit of background, and then I'll explain what ECHO is for people that may not know. So as background of why this is so important is that dermatology is a very important part of primary care, and nearly 1/3 of patients that are going to their primary care provider are typically going a skin condition present. And so it's a very big part of primary care. And ECHO, or Extension for Community Healthcare Outcomes, is a case-based educational learning platform where specialists can teach primary care providers about their specialty, so in this case, dermatology, to help improve patient outcomes. And so why this is so important is because a lot of times people that are living either in rural or underserved areas don't have access to providers that do the specialty care, or it will cost them a whole lot more to actually have the care provided to them. And so it's really important to be able to provide the care to these individuals in a way that they can afford. And so this way we can train primary care providers, be able to and help them with their cases in the case space that they're presenting if they're having a challenge. And we can help train them in the specialty care so they can provide the high quality of care. So we're doing this at the University of Utah in 2 different ways. One is in the rural and underserved areas located in Utah. And the second one, which is what this poster and presentation is about and what was started first, is we're actually doing this in Uganda as well for clinical officers. And so what we've done is we've partnered with the World AMTC, and that's the Accelerated Medically Trained Clinicians, and it's a network of clinicians. And what we do is we offer a teaching model. And so we have set it up so that way there are self-learning modules that are present, and then we have Codicom-based, dermatology-based ways for them to review throughout the month. And then once a month, we have these ECHO sessions where we're able to either have cases or continue to have these modules based on cases. That way they can learn not only how to identify the different skin conditions, but also how to treat them. And so we really want to assess the effectiveness of this, and is this high quality? Because there have been other ECHO sessions out there for other types of specialties, but it's relatively new to dermatology. And this would be a great way, if we can, to be able to educate and help more patients, especially those in rural and underserved areas. However, we really need to know, is this effective and is this a good way to go about it? So before and after each session, we actually gave them a 9-question survey in Uganda to be able to determine if it is effective. And those questions are on the table here. Just to name a few, it's, these questions are confidence. So it's a Likert confidence scale. So from 1 to 4 to determine how confident they are in each of these. So identifying and treating the skin condition. And when you say the skin condition, throughout these questions, typically each month, there is a theme. And so we've held 2 of these sessions where they have answered these survey questions. And as you can see from the results, it has been quite effective. So on the black line, we have our pre-survey results. Then on the red line, we have the post-survey results for each question. And so for these 2 ECHO sessions that have held so far in Uganda, we did have 8 participants that completed both the pre and post survey questions, and then 10 participants in the second session that completed both the pre and post survey. And so of those surveys, every single question did have an improvement from before to after the ECHO session, which shows that there is a large improvement there is an improvement, I should say, in the actual ECHO session in improving their confidence in treating or identifying or understanding the skin condition. So it has shown to be helpful for every single one of these questions. And then question 4, which is appropriately addressing patients' concerns with respect to the skin condition, showed the largest improvement from before the session to after the sessions. And then question 2 and question 3 followed closely behind. So prescribing the appropriate medication and then suggesting evidence-based ways to care for the skin condition. So what does this tell us? It tells us that Dermatology ECHO thus far has been effective at improving the confidence in these clinical officers in Uganda for each of these 9 questions, which we think is very important for improving care and improving clinical confidence as well in dermatology. And so moving forward, as I talked about, we will be having a lot more of these sessions. And so we're holding one again at the end of this month, taking off December because of the holidays, but we are going to be doing either 9 or 12 total for the clinical officers in Uganda for this group of people, and then these group of clinical officers, and then we will be doing it again, hopefully to get more people educated and interested. And then we are just started it here in Utah as well for the clinical officers, and we will be continuing it on, and we will be doing the same survey questions here so we can continue to assess the quality and effectiveness of teaching primary care providers here in the state as well. So thank you all for your time.
Well, my computer just announced it was 2 o'clock. But what a wonderful presentation. And really, you explored such a valuable topic when it comes to health equity and addressing social justice. Is like, how do you measure if you're doing that? How do you measure the effectiveness of your intervention once it's in the field? And how do you keep that training up? So thank you very much. We have some people in the session. Please feel free to put your questions in the chat. If you don't mind, if you could also place in in the chat a URL or email address where folks might be able to contact you directly if you have any questions. But thank you very much for this fascinating topic. And I know you're coming back later with another poster later in the day. So yes. Thank you. So we're going to go over to the next poster that's coming up. Okay. And wonderful presentation. Thank you.
Thank you. Thank you.
So I'm going to stop broadcasting here.